જય જીનેન્દ્ર.
જય જીનેન્દ્ર, ટીનાબેન.
કેમ છો? મજામાં?
યા, મજામાં.
So tomorrow you're doing on thyroid, Nainavin, right?
Actually, no. So the updated schedule it's on the Classroom, Google Classroom, but
Okay.
thyroid is going to be done by Raj, Dr. Raj. But he couldn't do it tomorrow, so I switched with him. So tomorrow I'm going to do about sleep.
Oh,
My book
wow.
was on sleep disorders.
Yog
Something
Nidra.
Yog Nidra, right. Well, I'm not going to talk about the Yog Nidra. That's for Somniji and Ramesh Bhai to talk about. I'm going to talk about the medical
Oh,
medical disorders of sleep and the medical management.
okay.
Yeah, so each of I'll talk at the end of the class at this time about how the next 12-week sessions are going to run, but it's going to be in that order, and I'm just sort of introducing it. Yeah.
That's great.
Yeah, so we can start our class.
Oh, okay.
Yeah, we didn't have too many. Yeah, that's good. Why don't we just? It's the time is there, right? Is already 8 o'clock? 7? Yeah, it is. Okay.
Exactly 8.
Yeah. Starts. Suruba is correct.
Okay.
As others will join as you
Right.
start.
Jai Jinendra to all and Vandami Naman Swami Samaniji. So today our topic is for common ailments and injuries. And usually this is more related with the disease you come across with our people. And so welcome today. We will explore how yoga can support healing and recovery from everyday ailments and injuries. So why yoga for healing? So yoga is basically, you must experience also with the pose you are at ease. It gives more flexibility. It removes the toxins because of the blood circulation. So a lot of things happens during asanas when you practice or when you do mudras, it helps. So many things are there for natural holistic healing. So it is very gentle, low impact movement. It enhances circulation and flexibility, reduces the inflammation and pain, supports mental and emotional well-being. So we feel more energetic once you are in a relaxed pose, and later when you do coyote surf, then you giving more time for the healing of all your organs, tissues, bones, everything. So that helps more, enhances the healing of the disease. That's why yoga is very good for healing in that case. And we'll follow the other one. So before we do yoga with the people with the injuries, first we always want to make sure they consult a healthcare provider and get all the permission and reports, so you know accordingly how you work with them. Avoid pain or strain, so you're not doing any aggravative poses like level 2 or level 3 poses. We already discussed in the past some of the poses. So you want to make sure you're not doing overstraining to those things. And usually in these cases, the props or straps or chair, anything helps to get a better pose. On Saturday, like Ramesh Bhai practice with a chair tree pose. So those kind of things also extra help. So you get balanced practice with the body and mind for the pose. And you always focus on breath and alignment. So you make sure when you do any poses, you first have a proper alignment, like you are having your feet, for example, put together, or you're keeping apart for balancing pose. Then you make sure that both feet are properly aligned on the floor, and then you start doing the poses. So you don't harm to your body and get any strain out of it. So those are very important precautions to be taken. So what are the ailments yoga can help with? So for example, back pain. If you do Bhujangasana, so in English is Cobra pose, it helps and strengthens your core, improves your posture, it helps your lower back pain. So for arthritis, it increases the mobility, reduces the stiffness when you do all the poses. It relieves headache from tension. It calms your nervous system. And it also helps your digestive issues, like when you do balasana or vajrasana. So those kind of things helps for your digestion. And insomnia promotes relaxation and sleep quality. And we will be knowing more about tomorrow with the sleep remedies and issues. So we'll go over that. So now injuries yoga can support. For example, the knee injury, like some people is athletic or having some kind of sprain or something light. These are all mild pains we are talking about, not about acute or, moderate pain, those kind of things. This is more with the mild pain. In that case, yoga really helps to get your body back into shape. So like, for example, knee injury, the gentle strengthening, avoid deep bends. So if you have injury, excuse me. So if your injuries, don't do too much bend or for example, chair pose, you're not giving too much, weight on the knee. You are doing just lightly chair pose and not staying longer on this pose. So not giving any more, strain to your knee to avoid any pain further. But gentle stretch will help to, repair your knee injury. So just do light exercise or poses in that cases. So it's same thing works in shoulder strain. So if you see this pose in the slide, it's very hard when you put your both hands like that. It's even for a normal person, it's stiff, cannot touch. So in this case, you can use like a handkerchief like that at the back, and you're holding like that. So you support, you get an extra room to hold like that, right? So you don't strain your shoulder. So, but this is the perfect pose if you can do it. But this helps to restore your joint of the shoulder. You get gentle mobility in that case. And same thing works with the wrist pain. You use fist or forearms, avoid any pressure. So we do like warm-up exercises like the rotations like that with the hands, or spreading your hands and fingers, doing mudras. So all those kind of things is going to help and remove your stress or pain in those muscles and tissues. And same thing is with the ankle sprain. When you sit in the poses, gradual weight bearing, you are not putting too much sitting pressure in those cases. If you are having ankle sprain, then you do more like standing pose or which ease your pain. But you can do light exercise sitting if it's not acute or moderate pain. Mild pain, you can do any workout that will take away your pain actually, and it will heal your body and tissue. And lower back strain. So again, core engagement, avoid forward folds, because at that time you don't want to strain too much. So just make sure on what injuries the people are facing. Accordingly, you do your poses in that cases. And if you have any questions, you can feel free at any time when we discuss on this. So the recommended poses are cat-cow stretch. In the class, we have done that. So that helps the lower back and the upper backs. It's a beautiful pose to stretch out your cervical stress, your lower back stress. So this is very good in that case. And the second picture, what you see is a bridge pose. So that's called in Sanskrit Setu Bandhasan. So you see the pose, it looks exactly like a bridge. So those are all logic with the poses. And we remember that way, that this is a bridge pose or Setu Bandh. And when you do this pose, it helps your hips flexor, your thighs muscles, and your shoulders get so strong with the regular practice. So this is a very good exercise for those benefits. And then we are going to discuss more on spine twist, rabbit pose, and leg up the wall. So we'll see in the next slide, and I can talk more on that. So this is a spinal twist. It's called Supta Matsendra Asana. So when you do that, again, it helps your spine to have more movements, and it will help from the stiffness of your back. So this is a very good pose for that. And and that will help your neck also. So when you, in this pose, when you see the knee is on the right side, you are folding, right? So your neck will go opposite side. Make sure when you're doing that, there is that kind of coordination and alignment of your pose. It's very important to get the benefits of it. So this is one of the very good asana for the spinal twist. And this is a sasang pose, and it's a rabbit pose. So it's very similar to Balasan, but rabbit pose, again, there are variations. Now, in this picture, you see that she's holding her at the back feet, but sometimes they go forward and goes towards the head upward. So there are all variations. So don't get confused. Oh, this is the only rabbit pose. There are all variations. So so this thing really helps the blood circulation in the brain when the head is down. It is very good for the nervous system. It calms you, quietens your mind, and digestion. It improves your digestion a lot. And not only that, apart from that, it helps your ankles to get stronger. When you are in this pose, your ankles get so stronger. So your legs and everything is benefited from that. So this is very good pose for those benefits. Any questions so far? Move forward. Okay. Now, this is the pose we are doing with the legs up the wall. So this is very good for the heart, for the varicose vein. This is a very simple stretch out. So this has been widely used nowadays for many purposes. So this, I just wanted to add extra, pose for healing. Now, another aspect when we look.
What's the Sanskrit name for that asana in the previous?
This one I have not found anything, because this was more I found on the anatomy with the medical. So I haven't gone through yoga purpose this pose. So if I find out in the future, I'll let you know.
Okay.
But it's widely used nowadays for any person can practice this. Or if people have, like cannot lie down on the ground, then they can do on the bed. Because some people, like knee surgery, for example, could not lie down, then they can do on the bed. But they should have some support of this, like a wall thing where they can put their feet. But it's very good for the varicose vein and heart. And this also gives a calmness. And they say like they stay like 15 minutes in this pose. Or even more. I was just reading on it. So even 5 minutes, 10 minutes, 15 minutes. So it's up to your call, how much you want to do.
I think it's called Viprit Karni.
No.
No,
Viprit Karni is, if you know shoulder stand pose, if shoulder stands pose, when you come little more down, that is Viparit Karni.
Okay.
When you hold your hands towards the hips.
Oh, okay.
Let me check one more time.
But Anujaji also, taught this one. Narendra Bhai, you remember that when we were at the center, she taught you outside this pose?
Oh, this pose you did? I didn't know that.
Yeah, Narendra Bhai.
I did it.
Yeah, that's Viparit Karni, I remember.
Yeah, but if you Google it, in yoga, Viparit Karni, I don't want to get confused, but I always learn Viparit Karni is little between shoulder stand. But I never found for this one. I will check on it.
Sure.
Yeah, you can say Viparit Karni, but I want after this, or even if you have phone right now, type Viparit Karni, how it looks.
Let me see. Okay.
Yeah,
I remember, this is, Viparit, but I'll make sure. Okay.
Yeah,
I know
but
in that you lean a little bit differently, not
Ah.
exactly touching, all the way, but again, I am not 100% sure.
Let me check. I want
It's
to
Viparit Karni.
Huh?
It is? Okay.
It's Viparit Karni.
That's perfect. Thank you.
Oh, okay. It shows in the Google Viparit Karni.
Yeah, I did not check,
So
honestly.
Viparit
I
Karni,
remember that
again,
she mentioned to us when we were
Yeah,
at the
yeah.
center, and
I
she
saw,
was explaining to Narendra Bhai.
No, Dinesh, but I saw that it's a variation of that Viparit Karni. They have written Viparit Karni for this one also.
Sure, thank you.
But if you see Viparit Karni original pose is different variation.
It's because it's restorative. It
Yeah.
falls under restorative yoga. That's
Yeah,
why
so it's variation.
labeled
Yeah.
as
Yeah, correct. Yes. But the conservative Patanjali Viparit Karni is between shoulder stand and your little bend in your hips. But this is another variation. You can put it that way. So thanks for telling me that. Okay. So you can call this as Viparit Karni.
Yeah,
Thank you.
Bina auntie, I think this one is just like the variation, right? Because the one you're saying is like more advanced pose.
Yeah,
So
exactly.
this one would be the modified one for the
Yeah,
individuals you were saying that have a hard time, like to do on the bed using the pillow, right?
yeah.
Okay.
So that's why I said it's okay. It's a variation. That's why I said that. Because I didn't read about this in yoga as a Viparit Karni. I just now saw, that's why. Because I was doing the second level of Viparit Karni. Thank you. All right, so this one will go for the breath work for healing. And this is the another aspect, pranayama.
Landed?
Sorry? Anybody was asking? All right. So this is like a pranayam for healing. So deep breathing plays a very important role for our, respiratory, blood circulation, any kind of, healing. The deeper the breath, it's more deeper, powerful healing. So if you do a diaphragmatic breathing, it reduces the pain perception. So you know where the diaphragm is located as an anatomy?
Below the stomach.
I think it's between stomach and lungs, right, Nainavin?
All right.
As an anatomy?
The diaphragm?
Uh-huh.
Yeah, between the lungs and the abdominal cavity.
Yeah.
So it's the stomach, liver, they're the ones that are just under the diaphragm. Correct.
Okay. So it helps that kind of breathing. It helps the diaphragmatic breathing helps a lot. Your lungs expands, your respiratory is more deep and smooth. So it is very important you practice diaphragmatic breathing. And the second one, everybody has done Brahmani Pranayam with the humming bee sound. And we are going to come with the pictures with that, okay? So on this picture we have is Sitali Pranayam. So I'm sure you must have practiced that. It gives a cooling breath by keeping your tongue out and like a cow when you breathe through that. So it gives a cooling effect to your body. And it is really helpful when the women are going through menopause, especially. But otherwise, in other sense, in general, also it's very helpful for cooling breath. So Brahmari Pranayam is, so this is the third slide. So first slide is Anulovilom, which we do alternate breathing, which helps. So I'm not going to go deeper in that because we are all aware of it. The second one is showing the diaphragm where we can see the position. So that red, about the circle is the diaphragmatic breathing. So that helps. And the third one is Brahmari Pranayam. Now, usually we did in meditation by closing eyes and doing humming sound. But this one, you see, it's closing your like that. What that means? Anybody? What that means? You see this picture, she's closing all her
senses.
So yeah. So this is called Brahmani Pranayam. So this is one of the way of doing also. So there are a lot of variations. This is just for knowledge I'm giving you. But usually we do humming sound after meditation. But this is another way we can do it by withdrawing from senses. You are within yourself and you're concentrating on breathing and doing a humming sound. It's beautiful experience when you do this, withdrawing your senses within yourself.
So Binaji, this one you close your ears as well, right? In this one?
Yeah, so this one, what usually is your two fingertips goes here near the eyes, and that this is above the, lips. So you're not closing the nose, okay?
No,
It's
no, on
about
the
the lips.
ears.
And your thumb goes near the ear. You're not putting pressure. You are giving a gentle touch, okay? You can try. And then you're taking a deep breath, and then
Humming bee.
try everybody. See how sensory experience you get. Bring both eyes, both fingers on your eyes. Then the other two fingers on the upper lips, and the little finger is just relaxing near the chin, okay? And lightly, gentle touch towards the ear, your thumb, both ear, your thumb, gently touch it. Okay? Now just concentrate on breathing, deep breathing. Just get normal breathing. Now take a long, deep breath, and we'll do a humming bee sound. Again, take a deep breath. Again, one more time, take a deep breath. Just get normal breathing and gently open your eyes. So you're withdrawing your senses. I don't know how you experience, but this is another way of doing.
Pratyahara.
Pratyahara, yes, in Ashtanga Yoga. That is after pranayam, you do pratyahara, and that what that means is you're withdrawing your senses, and then you're coming to dharana, dhyan, samadhi. So this is the bridge between pranayam and meditation to do this practice. That's how it's helpful. And so that's why it is placed after pranayam, pratyahara. That's correct, Naina.
That
It
was
wasn't
actually
Mehha
Puri.
ji.
That's Puri. But Bina, the gentle touching of your ear.
Yeah.
When you're saying gentle touch, you are actually trying to close it though, right?
Yeah, you close it, but gently, but you don't want to really pressure it, then you feel like an echo. So you're just
Oh, I
doing,
see. Okay.
sometimes some people press, then you
Okay.
start getting echo. You want to have like a very gentle touch.
But to close it though.
Yeah, you have to
not
close
just
it.
superficial, you're actually pressing it down.
Yeah, correct.
Yeah.
So that's why I said gentle
Because I
touch.
feel the noise is different if I'm keeping just a gentle touch, or if I'm actually pressing it not hard, but just closing my ear.
Yeah, that's why gentle touch is like light pressure.
Light pressure. Right.
Yeah, but you're not, because some people then start putting like that.
Making it too tight. Yes.
That's why I always use gentle touch. So
Okay.
they know, yeah. But you
So
put
Binaji,
very light pressure on the ear.
Binaji, in this one, in Brahmri, we normally try to make sound in your head, right?
Yeah, because when you do a B sound, it will vibrate that way.
Yeah, okay.
Yeah, because that's why this all process are so important, that if you follow this instruction, you feel vibrations in those locations. So if you do Kapalbhati, for example, because you asked me, see, in Kapalbhati, when you breathe, so automatically the pressure goes in the chest. It's auto. You're not doing anything. But that process itself makes you do that. But when you do that, so that will vibrate here. You will see that. And your focus will be there. When you do that sound, it vibrates, yeah. But it is very good to the brain. It really gives vibrations to the brain. That's correct. All right. So as we have been always practicing meditation, so like this book, I really love it. Ideally, Acharya Mahaprajnaji about Prexa meditation has given all kinds of, process like perception of psychic centers, perceptions of breathe, Kaiutsa, internal trip, so many meditations. So this all will give in different way benefits. So that really helps. So by practice of guided meditation or Yoga Nidra enhances these benefits. So yoga improves pain, tolerance, and mobility, reduces inflammation markers, enhances recovery after injury, supports mental health during healing, practice mudras, and practice all guided meditation, and that works like a medication. I always used to say that meditation works like medication sometimes when you calm and relax your body and mind, and it's really a very high level of practice with the breathing, helps a lot in many ways. I remember when I used to practice alternate breathing, Anulo Vilom, I used to do 10 minutes minimum when I used to practice. And then I started to get feeling. So it took me a while in the body to experience those benefits. So it's always good when you prolong the practice, the more the benefits are there. So this is like another meditation I always like to practice was to visualize on, we do white color also, or white crystal color, or Om. This is the symbol of Om. You can focus on Jyoti Kendra to announce the mental health by this practice. So these are the objects sometimes helps with the spirituality, also with the meditation to go a higher level of spirituality. So as we said, the people with the injury needs support. These are all the various things we have, like strap. Of course, you are having a mat, then blocks, a chair, and to even get our poses perfection, this props helps a lot also in that case. So you can never go wrong without that. So you start slow and build gradually, use props and modifications, avoid poses that aggravate symptoms. So any like bad moves, if you feel, right away stop that pose at right that moment. And you don't want to continue that because you will end up getting some kind of cramps or twists. So if you feel any discomfort while doing the pose, just leave it right there. Don't continue. Make sure you just get normal again and then again restart the pose. So that's very important. The practice under guidance if needed. If the person has any injuries, that helps a lot with the instructor. So you get the correct movements with the correct guidance of inhale, exhale instructions and the benefits. So I would like to conclude that yoga is a gentle, effective tool for healing, adaptable to many conditions and injuries, encourages self-care and resilience. So thank you so much. And I would like to add one more thing. I think this Saturday we'll do chair yoga. And again, that will be related to the people when you meet like any people having injuries or, doesn't have mobility or age, or people who are working on the office and want to do some, sitting on the chair in the lunch break or something, some like stretch outs, those kind of things will help in chair yoga. We'll discuss more on Saturday for that information. And if you have any questions so far, let me know. Thank you.
Thank you, Bina Ben. I just want to reiterate that the normal Saturday morning session that Rameshji does is going to be replaced by Bina Ben. And so please make sure you all attend. It's really important. It'll be at 9:30 and it's going to be on the practice of chair yoga and other adaptable poses and things for yoga. Correct, Bina Ben?
Yeah.
So one
Wonderful.
quick question, Binaji,
Yes.
will that be in person or will that be remote this
No,
coming Saturday?
so at home you can do it from home, but make sure you have a chair so you can practice with me also, get the feeling.
Sure.
Like how
But
Rameshji, you practice with
it will
Rameshji?
be remote then, okay.
Yeah, it's remote. Yeah.
Yes, our next in-person session, Dinesh Bhai, is on December the 20th and 21st.
So next, I think then the following weekend is all
Correct.
in person. Okay.
It's the
Perfect.
in-person session, correct.
Thank you very much.
That's
Nina.
also a very important session for everyone to attend that weekend.
I know because of
Yeah.
that I had to change my schedule, I was planning to go somewhere, but yeah.
Thank you. That's it's important because it's the only one we have before our midterm exams, and so we really want to do some practice of giving a class and things like that.
Sure.
So if we can all be there for the in-person session, that would be wonderful.
So that day I'm going to volunteer in center when you have on, I think 20, what date that was?
Yes, it's December 20th. Are you going to
Right.
be available, Bina Ben?
Yeah, I told somebody. So we are revising. So let me tell what I'm trying to do. I may ask each of you to, with the breathing instruction, doing poses, so you can revise that. And I will help you if you go anywhere wrong. So practice what you did, like sit, bridge pose, bhujangasana, with the instructions, and you talk benefits. Because I know you have been not given benefits, but at least search on Google in that case, because then it will help you to practice. We are revising, that's why. I feel that you will be more comfortable in January doing things. So on that day, I will try to help to talk benefits also and how we do the class with the people to get some idea of it. And if you all can do one of your poses, you can select and just do it. You will love it. You will gain more confidence to do it.
Bina Ben, will you be there in person that weekend? Because I was confused. I must have missed.
Yeah. I'm coming on
Saturday or Sunday?
I think Rima is doing Saturday, right?
So she's actually going to do Sunday now.
Oh.
We can talk about it afterwards. If
Yeah, let's do
questions
that.
For your lecture.
Yeah, we'll do that and we'll discuss. But try to prepare yourself. You have enough time to gain the confidence.
100% is going to be
my main goal is to you have the instructions of breathing for those poses, for even one pose. That will gain you in all poses. I think that will help you more.
Very good, Bina Ben. Thank you. Yeah.
Okay, thank you.
Great session, Bina Ben. Congrats. Very nice session.
Thank you. Yeah.
It was really a good session.
Yeah. And even I did last two sessions with the slideshows. There are many poses given with the Sanskrit name, sequencing of yoga. And today's you have some of the poses. So like rabbit pose, and those things are in your syllabus. And you're aware of it, little bit of it. So I think you will be good. Like you do great meditation nowadays. So you will catch up with this practice that weekend for the future preparation.
Or yoga. Yeah.
I think.
Correct. I actually think this was a very good lecture, Bina Ben, as a segue to what's now going to follow for the next several weeks till the end of the course. It's going to be all about the health benefits of yoga and asanas and pranayam and meditation and mudra. And that's going to be starting from tomorrow, all our medical talks. And the first one is going to be on sleep. And then subsequently, there'll be different medical conditions. So please check the schedule if you like on Google Classroom. It's all up there to see what's coming next. But they're all going to be very interesting, and they're going to be in the order of having the medical disorder, medical management first, followed by sometimes talking about the research, but then it will be the pranayam, mudras, and mantras by Samniji. And lastly will be the yoga asanas for that specific condition, spoken talk given by Rameshji. So it's going to be a great package for each condition. So everybody should really learn a lot from that and enjoy it too. So this was a great segue. It was a perfect talk.
Yeah, because nowadays is so much injuries than before, health issues like
Yes.
diabetes, blood pressure, arthritis.
Mm-hmm.
We have more stressful life nowadays, and even the food we don't get organic, lot of pesticides and those things. So even that makes you unhealthy sometimes. So many things are involved, So at least this all practice helps us to regenerate whatever we can do in our conditions. That's the only thing I, try for the goal in yoga. And the more you do asanas, the more perfection you get. So first few weeks it's hard, then your body will start getting toning, and you will experience your each muscles when you do how you experience, like a rabbit pose, asana, bridge pose. Bridge pose is beautiful for your lower back when you raise up. So Rakesh bhai, now you know how to do bridge pose. Okay. So these all things helps your thighs, during
Yes.
that. So you feel it and you talk actually. You
Yeah.
feel all these things. You don't have to memorize
Mhm.
everything. The feelings comes out when you do period of time. I mean, I'm not saying now, but period of time. So first time, like 3 times you do poses is good. Once you get mastery, Sheetal, I think we talked about that how many times. So first new time, when you are a beginner, newcomer, do 3 times. Once you get mastery, 2 times. But 2 times is a must, must, must for
Mhm.
all pose. 3 times is excellent. I love 3 times. But sometimes people don't have time, so they want to rush, rush, rush. But I feel that if you do 5 poses perfect, is better than doing 8 poses. You want to do more with the meditative way. I mean, when I come in class, I'm going to show like what you do in little second level, like holding little bit. If you're on Cobra, you're waiting little bit. You're not just going right away down. That few seconds is the time where it helps your thyroid, your neck, because you're giving it the time at that moment. So this all awareness is very important when you do the poses. But you don't want to stay longer, but you don't want to be quick as well. Even Surya Namaskar, you gentle, politely, you see each of the muscles, you can feel it. But if you do like our aerobics, oh, I did like 12 times in this minutes, then it's more like an aerobic. You're doing more like an exercise. But if you do with awareness, oh, and inhaling, going back, exhaling, coming forward, that process is totally different. You experience, your breath, your body movements, your flexibility. It's a lot of difference when you practice with the awareness. I'm just trying to, but as I said, you get into it, once you do that. Like in Balasan, how you stay longer, you feel so good, for example, or any Talasan if you're doing tree pose. So if you stay more longer while raising the heel, what happens? If you're doing in just 20 seconds, if you stay 30 seconds, what happens? It helps your ankles more stronger, right? So that 10 seconds makes difference. So we want to make sure we give some time if you're comfortable with that pose and feel that benefit out of it. That's the main goal. What I'm trying to say is that. And you will understand your body very well. And that will take you to the meditation depth, deepness, more greater level. Because then your body is so relaxed after exercise, and your body stays still during that time to get that feeling, to focus on your organs, because you are away from all those pains, and now you're going internal within yourself during that period. So that's why stretch out is very important before you do meditation. So your body is relaxed with the muscles and stiffness and everything, and ready for the meditation practice.
One quick question, Binaben.
Yeah, bolo.
We were supposed to get manual for the yoga poses. Do we know where we are with those, or with the manual?
I think Ramesh Bhai was doing on that, Nainaben.
So actually, Dinesh, by the manual per se may not be coming out as a booklet, or if that's what you're expecting, but we're posting all the poses online on the Classroom, Google Classroom, or also in the WhatsApp, and the actual step-by-step way of doing them. Rameshji is working on that, and I think he should be having that out before the midterm exam. I will follow up on that because yes, it's easier to have a manual, I think, than when you're trying to follow the steps. Is that what you're asking about?
Exactly.
Yeah.
Madam.
Yeah.
Thank you.
So that manual, that instruction is going to be for each of the poses posted by Rameshji. And I'll get back to you as to how soon we can get that out.
Sure. Thank you very
Maybe
much.
hopefully before, maybe if we can get it before the 20th when we have to do our practice session, it might be useful.
Absolutely. Thank you very much.
So I was giving one suggestion also, like, I mean, if you go like Books a Million or that store, and there are so many yoga books, look by yourself what is good for you, because you have something to look, and they give all instructions in here, because they're not going to get confused. The reason is because you know your curriculum, you select that way, but at least you are getting acquainted how it is written and what are the instructions, what are the benefits. So you feel more confident, when you read about it. And
Do you have a suggestion, Binaben? You have a suggestion of a book?
I know one is B.K.S. Iyengar. He was a very good yoga philosopher from India. And I mean, he had a mastery. And then there are some American authors also. And there are with the, I think, DK books or something. I will look into it and I will
Maybe you can post it on the site.
post. Yeah, there are
Also,
other books.
Anuja ji gave us a book, Naina, if you have that.
Yeah. So
you can.
I went through that, and it doesn't have all the poses, or it has some of them. But I can look at it again.
Maybe you can just take pictures and
Yes.
steps of those and then post it in the WhatsApp group.
Yeah.
That way, for the ones that we've learned, so we can just, because when we're teaching people, I know we're trying to memorize everything, but initially it helps us point out the main steps in there. So
The one from Lebanon we can use, but the reason we've not sent them out already said they'll copyright it. So the reason we're delayed is all the ones that we get from books are copyrighted. We're not getting permission from the authors yet. So we just have to be cautious because it's a legal kind of course. So we got to do it where we maintain copyrights of individuals. But the books are great to buy. So Bina can suggest books and you buy them, then we're completely okay,
Yeah,
It's just otherwise we have all those books, but I can't copy and paste them because they're copyrighted.
Let me see if I have right now available here, I can show you.
I can send the PDFs. I have PDFs of Bihar yoga books. They are going to be wonderful for you guys, especially for asana bandhas and one more. I'm sorry, what am I? And pranayama.
But
I can
make
send
sure
it.
they're
I have
copyrighted.
PDFs.
But if they're copyrighted, we can't use them. The problem is the copyrights, not the.
No,
we have a lot of access, but unless we all acquire them, the copyright rules are difficult to, we're going to follow the rules.
Okay. I mean, I can send all I was going to do is I was going to send the link so you guys can just type in Bihar yoga books and
Yeah,
they're
no, that's
available
completely fine. Yeah, you can buy, purchase it, or define they get free for you to use. That's fine. But as a organization, we can't use them because we are liable individually. You can certainly do things. Yeah.
Yeah, no, I understand. So, just for reference, you guys can find the Bihar yoga books on if you want your own copy, like a physical copy, you can get it available on Amazon. And if you want to just take a look at it and read it, it's available on Divine Light Society, the website.
Can you post both of those names on the chat so that we can see what you're talking about? Thanks.
Sure.
Okay, this is the one of the.
The Iyengar. Okay, it's not showing through the thing, Bina Ben.
Oh, it's light hours. Huh?
Yeah, yeah.
Mhm.
But they have, I mean, I will send because they have a lot of pictures, you know.
Oh yes, like that. Okay. Just post the names on the.
Yeah. So what I used to do when I came here, I went to first they had a Barnes and Nobles. I used to look all the books, whatever were available, and then what you like, what you feel this is comfortable for me to understand, I'll buy that book. That's what I do.
Mhm.
And you cannot go wrong with this author, B.K.S. Iyengar. So it is B like boy, period K like kite, dot S like Sam. B.K.S. Iyengar, Iyenger.
What's the title of the book called?
So the book is called Yoga, the Path to Holistic Health.
I messaged it to everybody in the group chat.
Yeah.
BK Iyengar.
Yeah.
Is that the PDF
Thank you.
we can download from? 1 second. I don't see any way. Oh, it's not. I thought you said in the WhatsApp group.
Yeah, I just messaged the books with
Bihar
Book
Yoga.
the
name.
names. I didn't do the thing, but I just typed in Bihar Yoga books. You guys can take a look at it. If you want, you can message me individually and I'll send it to you.
Sure. Thank you very much.
Yeah.
I will be able to get also that message or no?
Okay, it's in the group,
Yeah.
what WhatsApp group,
If
Binabel.
if you want to just message me individually, I'll send it.
Is Yoga 2020?
Nainabel, તમે મોકલી દેજો ને.
Yes, I will do. I think you're on that group, Bina Ben.
Yeah, so
Yoga 2026.
So I will look at it also. You know.
Okay.
Yeah, so I think that will help because if something is there to look, that helps for the practice.
I just want to say one thing in terms of the yoga books that are written by people that aren't like South Asian or like Indian specifically. From the books that I have read, there is a lot of misinformation. So I would use a lot of discernment when you guys are reading about the yoga books that are written by, please pardon if it comes off racist, but that are written by white people. Like it's just they mean well, but I think we had a conversation in the previous yoga classes. But they mean well, I think, but their understanding of a lot of the philosophy, like the limbs of yoga, it gets lost in translation. So I just want you guys to be cautious of that. That's all. Just to use discernment. I think they have a lot of information. They provide great value, but just to use that level of discernment when you're reading from like non-Indian.
So that's what I was saying, that when you go there are so many books, look which one suits you, the language and everything. And you just grab it. And a lot of Western authors have written wonderful books also on yoga. So as I said, I used to look a lot of books and whichever language I liked it, I picked that one. But Iyengar was a very experienced person in India. And I mean, he did all poses very well. And as I said, there are so many Western books also very good. And they have given a lot of variations in yoga. So that helps a lot also. So just see what is comfortable for you all, you know, when you look at it, the books. That is more important. Like somebody, it's hard Patanjali Sutras to use, read and understand. But in Western, they write in a very good way, in common language, you understand better those sutras. So it's all about, like for example, Viparit Karni. I didn't even knew there's a variation for Viparit Karni until I saw today. My understanding, I did a conservative Viparit Karni in my life. So it changed, you know, and I never paid attention to that actually. But it's good to know, you know, with the variations, they put the name. But as I said, so that is the Western world, which gives also more information. So it's just what you like, you pick. That's why I don't give particular names, but that's why I want to look, because in library you can look any books, right? And there's no limit. So you get Western book, you get B.K. Iyengar book, like 3 authors, and see which one likes you, which appeals you, which is more easy for you to understand the language. That is important than anything else, because all books are going to give information of instruction, benefits, and poses. But B.K. Iyengar has written a lot of book on pranayam, then Raj Yoga, all the yoga books, Satvik, so many things he has done research and written on it. So, and in our Preksa also will check more on other information also. And meditation, Acharya Pragnaji, I mean, unbelievable. It's beautiful. I mean, he has covered all the aspect of our body, our spirituality experience, everything in that book is beautiful. All meditation explained scientifically, methodical. You cannot go wrong. The logics are great, and it's just the practice and experience. You should feel it. That's it. Thank you. I'm done.
Yes, thank you, Ilaji, for your wonderful session and
Thank
talk.
you, Vandana.
Yes. So you have explained your things very well. Now all the questions have been taken now, is it?
Yeah, I think so.
Okay. So this is the time for meditation. You have one more topic, is it? To cover,
Uh,
Binaji?
no, I think I did today with the injuries of yoga healing, and I talked a little bit of chair yoga, how it's going to be. So we'll do, they will do online on the chair, and
The
from the
practical
center,
demonstration.
I will do demonstration. So even I want them to do also practice, so they get the feeling as well, because it's going to be very simple, because chair yoga, you won't feel it because you all are healthy. But this is for the people who have inability, injuries. For them, it's difficult to do in normal pose. So we are doing in that angle, that how we can help them to do this pose. So but you won't feel it that much effective because we are doing on the ground and we are healthy. So this is something like how Rima is going to explain. So like people who have really difficulties, they can still get benefits from yoga. With even chair yoga, you're not actually going away from it. You can you can work mudras on the chair. You can do meditation on the chair and asanas, some of the stretch outs. So I think that will be a helpful information that way. So chair, without arms will be more good. And with arms also is okay. Only without arm, I think bridge pose is the only one I think you need without arm. But other poses are okay if you have arms on the chair. But otherwise you're fine. But yeah, everybody keep one chair. So you can also practice when we talk and do the poses. And even that time, you will know how you do the class. Inhale, exhale, all those instructions will be given. So even you will be talking and doing by yourself. So you'll get that experience too when you do that.
So chair yoga is also good for for the old age people.
Yeah, I said age people, in mobility, and the people who work in the office. For lunch break, if we want to do just chair yoga, they cannot go out or just do all those stretch outs a little bit. So even for them, it's helpful. Senior people, Yeah, and the people who have injuries, surgeries, those kind of people.
So today's Sachi has not joined the session. She was going to give the session, meditation session. Sachi is not there,
Yeah, she-
is it? Okay. So today we will practice again the perception of body. In this week, we have to practice the perception of body. So anybody is ready to give the session? Rakesh ji?
Ji, Samni ji. I will try.
Yes. You have the book.
Not in front of me right now.
Okay.
I'll do it from memory.
Okay.
Or
Otherwise,
yeah,
it would
any
be
other
better
person.
to follow.
Yeah,
It would be better to follow the
that's
text.
right.
So,
Samni ji.
yeah.
Somebody else
Otherwise,
can
there
do
will
it.
be,
That'll be better.
yeah. Yes. So today I can give the session. Is it? So
Yes,
everybody
please.
has to have this handbook of Preksha meditation, which is which is posted on Google Classroom. But when you will be here in person, then you will get the copy, physical copy. Okay. So now sit in the comfortable posture with a straight backbone and neck. Keep both the hands in the posture of knowledge. Close your eyes softly. With 5 Om sounds, we will start our meditation. Take long and deep breath and making the Om sound. We will start our meditation. Om. Om. Relax. Relax your body, mind, and vocal cord. Concentrate your mind on the big toe of your right foot. Give suggestion to be relaxed. Relax. Relax. Feel relaxation in the toe. Now see all other fingers of the right foot. Give suggestion to be relaxed. Relax. 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 In the same way, see the soul, heel, ankles, calf muscle, knee, thigh, up to the hip joints. See all the functions, sensations, vibrations. Give suggestion to be relaxed. Relax. Feel complete relaxation in the throughout the right foot. Now concentrate on the left foot, starting from the toe to up hip joints. See each and every part. Give suggestion to be relaxed. Give suggestion to be relaxed and feel complete relaxation. In the same way, attain the relaxation of your middle portion up to the neck. See all abdomen organs, internal and external. To the collarbones, see each and every organs and give suggestion to be relaxed. Now attain relaxation in both the hands. See the right hand from thumb to shoulder. Give suggestion to be relaxed. Relaxed. Relax. Now concentrate on the left hand from thumb to shoulder. Now concentrate on the facial organs and brain. See each and every organ, each and every neurons. Give suggestion to be relaxed. 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 Now we will practice perception of body. The practice of the perception of body consists in concentrating the mind on each part of the body, one by one, and perceiving the sensations and vibrations taking place in each part. Of course, here the perception does not mean the visual perception, but the mental one. The sensations may be superficial sensations of the skin, such as the contact with your clothes, warmth or coolness, itching, and perspiration, etc. Or they may be the sensations of pain, numbness, tingling, etc. felt in the muscles or the vibrations of the electrical impulses in the nervous system or any other type of vibrations. Starting from the surface, you have to penetrate deeply inside and try to become aware of the internal and subtle vibrations. Remain completely equanimous towards the sensations. Try to keep your mind free from all like and dislikes. So now we will practice this meditation. Concentrate your mind on the big toe of your right leg. Allow it to spread and permeate throughout the whole portion of the toe. Perceive the sensations and vibrations taking place in that region. Become aware of them. Experience them without any like or dislike. Use deep concentration and remain fully alert. Practice body perception of body with full alertness, full awareness. Full awareness. Now shift your attention to each part of right limb, one by one. See the other toes, the sole, the heel, the ankle, the upper part of foot, the calf muscles, the knee, the thigh, up to the hip joint. Concentrate on each and every part. And see what is happening in that particular part. Practice meditation with full awareness and concentration. See each and every part. Experience all the sensations and vibrations taking place in each and every part. Without going into any like or dislike. Maintain full equanimity. Just you have to perceive the part of your body one by one. In the same way, practice perception of all the parts of your left foot. Toe, fingers, sole, heel, ankle, upper part of the foot, the calf muscles, the knee, the thigh, up to the hip joints. See each and every part with full awareness and concentration. Now the trip of the lower body is completed. Start the trip of the middle body from the waist up to the neck. Concentrating your mind on each part, one by one. Perceive the waist, the navel, the abdomen, including the big intestine, the small intestine, the kidney, the spleen, the liver, the pancreas, the duodenum, the stomach, and the diaphragm. Then see the whole portion of the chest, including the lungs, the heart, the ribs, the throat, and the vocal cords. Concentrate your mind and perceive each of these parts of your middle portion. Try to see each and every functions, subtle and gross, of each of the organs. Now practice the perception of the whole portion of the back, including the spine, the spinal cord, and the neck. Now concentrate on the whole portion of the right hand and arm, including the thumb, the fingers, the palm, the wrist, the lower arm, the elbow, the upper arm, and the shoulder. Perceive each part one by one with full awareness, full concentration, and see what is happening in these different parts and organs of the body. If there is pain, visualize it also. Like the right hand, concentrate on the left hand and arm. See the entire hand. Feel each and every vibrations, movement, internal function. The trip of the middle body is now completed. Now we come to the upper body. Concentrate your mind on each part from the chin up to the head. The chin, the lips, the inner portion of the mouth, including the tongue, the teeth, the palate, the cheeks, the nose, the right ear, the left ear, the forehead, and the head. Perceive each part one by one. During the perception of the tongue, allow your tongue to remain hanging freely without touching anywhere inside the mouth. While perceiving the head, perceive all parts of your brain, the front, the back, the right, the left, the outer, and the inner. Allow your mind to permeate throughout the brain. See the function of each of the neurons. The trip of the upper body is now completed. Now practice the perception of body as a whole. You may stand up slowly and carefully. Keeping your eyes closed. Allow your mind to travel from the big toes to the head and from the head to the big toes, rather speedily. As we scan any book, you have to scan the entire body from toe to head and head to toe in the standing posture. Passing through each part of the body, perceive the vibrations throughout the body. Experience a tingling sensation in each and every muscle, skin, nerve, and cell produced by the contact of your conscious mind. You may also practice the holding of breath for a while, intermittently. Get yourself completely absorbed in the perception of body. Now allow your mind to travel throughout the body rather slowly. If you experience pain or any other peculiar sensation, you may stop there for a while and perceive it with equanimity without any like or dislike. Scan minutely and with full awareness. Now, with 2 long and deep breath, we will come out of meditation. With 2 Om sounds, we will conclude our meditation. Om. Om. Now, rub both the hands and keep both the hands on your eyes and open your eyes gently. So now the process of perception of body is clear to everybody.
Yes, Samniji.
Just we have to concentrate on each and every part of our body and see the little, we have to stay for a while with each and every part and see it deeply. So our mind starts penetrating into that particular part in its functions and also the subtle bodies which are working behind. So slowly and gradually we penetrate in the subtle realities of our body. And ultimately we reach out the soul, the main original source. Okay, so very relaxing. Okay. Anybody wants to say anything? Or it is okay?
It was good, Samniji.
Yes. So tomorrow who will give the session? Rakesh would be ready.
Ji, Samniji.
Okay. So you can see the handbook which is already posted.
Mhm.
Okay. So thank you very much.
Nami naman
Thank you.
Vandami, Namaswami, thank
Yes.
you.
Vandami
Yes.
Namam Sami Samniji. Thank you.
Samniji.
Thank you. Thank you. Thank you for
Vandami
joining.
Namaswami Samniji.
How was meditation, Nainaben? Okay. So Nainaben has not listened. Okay.
Sorry, kya bola hai
Binay,
Samniji?
how was the
Fine.
meditation for you?
It was good, Samniji.
Your mind was wandering here and there?
I even put my AirPods on so I can hear better, but yes, it was still wandering here and there. I feel that the whole relaxation you do with the body at the beginning,
Yes.
it sort of completely relaxes the body, and then you're going through the same system again, like for
Yeah.
each perception. So I was just like getting like a little bit distraction.
Oh, see, whenever you are doctor, no? So some patients come to you and what you say that first relax, no? Then you start checking his or her heartbeat or
Correct.
any problem in the body. Until you relax, you cannot scan.
That's right. So I'm trying
Is
to
it?
differentiate between the relaxation and then the perception. I'm
Scan.
trying to get to the stage of the perception from the relaxation.
So I think the
Yes,
first stage
when
is
you
called
become
higher.
when you become relaxed, then you can easily penetrate what is happening inside. If your body is in motion, you cannot judge what is inside or what is happening inside.
Right.
Okay, so
I mean,
first you have to be relaxed, then only you can penetrate in the inner functions of the body.
So
no, yeah, I
Samriti,
understand. Right, Samriji. Take care, Samriji. Definitely, we have to be relaxed. But what I'm trying to move on from the relaxation to the perception.
Correct. Just in relaxation, we are first coming out of the stress, tension, any kind of tiredness, fatigue, okay, or
So I'm not there yet.
stiffness. Yeah.
Yes,
So first
yes,
you should come out of that because your mind otherwise would be anchored in that stress or tension or pain or any such things. So
right.
first you have to make your body free from all those things.
So
Then you
that
should
was good. That was
then you
good.
should start scanning what is happening. If body is still, then you can easily penetrate in it and can see
Okay.
its reality.
So that I have difficulty seeing. So the scanning, then I
Mm.
start using my mind too much. Am I supposed to be thinking about how everything is there in each?
No. We are not thinking. We are just
Exactly.
perceiving. We are
That's
observing. We are observing, and observation is the power of soul. It is the function of the soul and not mind.
right. And I have such a difficult time moving from my mind to my soul. It's going to
Yes.
come. I'm going to work on it, Somniji, but
Yeah.
I'm getting much better at relaxing anyways. So I relaxing very well.
Correct.
And then to start to do the perception, I was starting to use my mind. So then my mind starts to wander and then it starts to
Yes. So you
go.
doctors first say that relax, relax. If you are operating or you are doing what you say, etc., etc., then also you say that plus
Let's
relax.
relax. Yes,
Ah,
we do. And
take
actually,
long,
I know the anatomy of the body.
take long breath. You say, is it? Because when you take long breath and you relax, then your body you can scan properly, or you can take extra
Yes,
proper.
yes.
Extra can come in a proper way, in a way.
Correct,
Is it?
correct. All the time you have
Yes.
to relax.
So you yourself is doctor and you know how body functions.
Yes, and also I know how the body looks as well. Like I know all the parts of the body. So I should
Yes.
be able to visualize it better. But then I
Yes.
think I visualize it with my mind. And
Don't worry. Don't think about mind. Just you have to observe. You have to scan.
okay, Samniji. Take care, Samniji.
Just fraction means observation, pure observation.
Right.
So in research, what you do, you observe, you try to observe the data or any experiment you are doing. So you are just observing the parts of the body and perceiving what is where is it. So you are not
Yes.
putting your head in that. Just you are perceiving the object or the particular part of it, body. You are trying to see the function of that particular part, how it works. Yeah. So just you are not. There is no scope for putting your head into that. You cannot think. You have to observe the reality as it is.
Yes.
Clear? So there is no need
Practice.
to think about anything, no supposition, no imagination, only pure perception. Pure perception. You and reality. Your perception and reality. There is no in between. Nothing is in between.
Okay, Swamiji. Thank you.
Yeah. Yes.
Yeah, it's very clear. It's just difficult to do.
Yes. This is the Buddhism. Buddhist people said deconceptualization. Don't think anything. Just try to observe and observe.
Okay.
I think
Reality will reveal to you.
Okay.
It will say that what I am. Okay?
Mm-hmm.
You need not to say that what you are. Is it? You have to wait. That reality should open to you.
To come to me. Mm.
Yes.
in
there
Patanjali
is
Sutra, it says Chitta Vritti Nirodh, stoppage of thinking. It's a
Stoppage of
Yes.
thinking.
sutra.
Yeah. Yes.
And then you start meditation. That's where the hindrance comes.
Yes, I know.
But the best part is you are aware of it. So you will be there soon. Because now
Yeah.
you know.
I know.
Some people even don't know
I know
what
what I
is
can't
hindrance.
do.
Exactly. So, and any normal people will have that feeling.
Mm,
And then they go towards internal more. So that's good.
mm,
At
mm,
least you're aware of it. So, and usually it's Chitta Vritti Nirodh, start with meditation.
mm,
Patanjali.
mm.
Yes.
So,
What Rakesh is saying.
so I was just trying to confirm that when we are thinking about, when we are doing Sharir Preksha, in Sharir Preksha, we are just observing and we are not auto-suggesting. If we see
Yeah,
a
there is no
problem
suggestion.
area in the
There is
body, there is a pain in some place, then we are just observing and trying to see where that pain is coming from. But we are not auto-suggesting that the pain is getting better.
correct. We did not to give suggestion.
Okay.
Automatically, it will be normalized when you start perceiving it. Okay?
Yeah.
Because wherever your concentration is deep, the healing energy flows towards that part.
Okay.
And it works. Clear?
Yeah.
So first you have to identify where is the problem in the body.
Right.
So doctors they do first testings, they diagnose first.
Yeah.
Then you can give proper treatment.
Right.
So thank you. Now it is clear.
Okay.
Mm. It's very clear, Swamiji. Okay.
Thank you.
Thank you.
Thank you, everyone.